Excellent, thanks. Good afternoon, Mr. Gill.
Yes, good afternoon, my lord. The next witness, indeed the final witness today, is Paul Arkison.
Good afternoon. I was about to say good morning, but good afternoon, Mr. Arkison. I'm sorry.
Good afternoon.
Mr. Arkison, your full name, please?
Paul Stuart Arkison.
Yes. You have provided the inquiry with a statement. The reference to it is SCIWT 0435 and 501. And this is, you are giving evidence on behalf of your union, the GMB.
Indeed, yes.
And you've also provided us with a number of letters, principally letters, that have passed between your union and, in particular, from your regional secretary, Gary Smith, or yourself, and were addressed to ministers, either the First Minister and or the Cabinet Secretary for Health, together with some letters which were sent out to your members, and some which passed between MSPs. And you put those letters in at the end of your statement, and we're very grateful for those, and those will all be taken account of as we're progressing on. You're agreeable, I think, to your statement being published and also the evidence that you give today being recorded.
I am.
Thank you. Can I also say at the start that there are certain parts of your evidence and certain parts of your statement, rather, particularly those which relate to economic hardship encountered by your members that have been passed to my colleagues in the inquiry who are looking specifically at issues relating to welfare. So you will no doubt be hearing from them if you haven't already. You will be hearing from them. You provided an overview of the union, the GMB. You are a senior organizer with the union, and that's a role that you've occupied for the past 5 years. But you've worked for the union for around 16 years in total.
Correct.
You explain in paragraph 3 that you head up the union's organising team. Can you explain what that does and how it operates?
Yes, certainly. As you rightly say, I'm a senior organiser with GMB Scotland, and the team that I head up is classed as our organising team. We would have areas of responsibility that we would be working on. We would also look at driving issues that would bring in new members, dealing with those usually first points of contact when people come to the trade union, and we would act on them appropriately and represent our members in the best way possible.
Who reports to you?
As in who would be in my team?
Yes.
Yes, it would be a mixture of organisers who would have responsibility for dealing with employers, assistant organisers as well, and also work with support staff, clerical admin staff.
I think it's important to note that the GMB is, as the name suggests, a general union.
Yes.
And as you explain in paragraph 8, you represent workers in a number of different sectors.
Yes.
You have 60,000 members across all sectors in Scotland. And as you tell us, the main areas are in local government services, the private care sector, and the NHS.
Yes, I agree.
And you make the point that in local government and care sectors, your members are predominantly female.
Yes, I would agree, yes.
And in manufacturing, predominantly male.
Yes.
Yeah. You point out at paragraph 20 of your statement that your main involvement was in relation to the care sector. And at paragraph 21, you indicate that the relationship that your union had with certain employers in the care sector was not of the best. Is probably one way of putting it.
Yes, I would agree.
Can you explain why that was?
A lot of the private sector employers in care, we wouldn't have what we would class as formal recognition agreements. So essentially bringing issues that would be of concern to ourselves and our members where there was recognition agreements in place. There would be certain procedural elements you would go through where you could raise things at a reasonably low level and work your way through whatever procedures were in place. When that wasn't in place with companies where we had a significant footprint of members, the first port of call would have to be at whatever level we could find within the company, and sometimes I think employers would see that as slightly confrontational. They would maybe suggest that this is the first time they've been made aware of these concerns, and possibly that there wouldn't be any internal procedures there for us to escalate matters through. So in times it could be seen as quite adversarial and quite confrontational. I would assume employers would look upon it like that.
You do say that in paragraph 21 that as a result there was a huge amount of mistrust and anger towards these employers from your members. How did that come about?
Our members would contact us initially with certain examples of what was going on in their workplaces, and of course our first reaction would be to look after them, try and provide support and advice. Sometimes that support would actually be contacting the employers direct if our members didn't feel that they had the means to do so or were reluctant to do so. So we ourselves would be contacting employers, and employers would maybe see if they didn't have any sort of prior relationship with us, they would see that possibly as someone external coming in to interfere with their affairs. And I think from that point of view, I think that's when concerns would start to build up, and in some cases we didn't have the best relationship with employers at that particular time.
Was that across the board, or was that in relation to certain employers?
No, I would definitely say certain employers. I think there is a difference where we can have, I wouldn't say it always works out well, but when there's certain procedures in place and we can see and both sides can recognise them where to bring up certain things, and if issues can be resolved at a lower level and usually quickly, that would be the way that we would want to do our business. But if we didn't have that in place with relatively large organisations, then it would take time and we'd have to raise those issues quite directly with the employer.
Okay. You do tell us that on the 20th of March 2020, your union wrote to all private care companies where you had members seeking a national strategy to guide the whole care workforce through COVID-19. Now that was obviously very early in the pandemic, and obviously very early after, well, indeed before the first lockdown. What was it that what was it that instigated you to do that?
I think certainly in the private care sector, our membership is wide and varied, so it would cut across organisations where, going back to what I said earlier, where we would have formal recognition agreements in place, in other areas where we don't. And I think we were picking up at that particular time from our members that there was going to be, in certain areas where we didn't have that recognition, and we also knew that prior to the lockdown, I have to say, we believed that the private care sector was already in a crisis with low staff and a reasonably high turnover of staff at that particular time prior to the lockdown happening. So our concern was that as things were starting to build up, that things would only get worse. I think that would be the reason behind it.
Were you envisaging difficult times ahead based perhaps on what you had seen emanating from Spain and Italy in particular?
I think it probably would have, I think to be fair, it would have had a bearing on it, yes.
Yes. Okay. Now, throughout the pandemic, you, as a union, carried out a number of surveys, and throughout your statement, you've made reference to these and provided information from them. In the context of the pandemic, why did you feel it necessary to carry out these surveys?
A lot of the time and a lot of our work, we're very much member-focused and member-led. So a lot of our work would be actually going to see our members in their place of work, experience what they were doing, and getting a feel for what the mood of our membership would be like at that particular time. So prior to this, we would survey our members, regularly anyway. But when the lockdown came into place, those workplace visits immediately ceased. So to get our information, we had to look at other formats and other ways of doing that. And the surveying our members directly was one of those, and I think they were reasonably well responded to. So that gave us almost at the time a kind of snapshot or a real-time view of what our members were experiencing. So it was really to supplement the workplace visits that we used to do prior to the lockdown, which ceased.
Were these surveys subject specific?
They could have been if, so for example, if a group of workers had came forward with something, or if we'd picked up that maybe something had changed or was of concern to our members, then yes, the subject of it would be directly related to that particular topic. Other times they could have been possibly more general, as in things like the social care fund, who would be able to get access to it. So it would be a mixture, to be fair.
Okay. We've had some evidence this morning from Ms. Foyer, the General Secretary of the STUC, and she has told us about the engagement between the STUC and its affiliates, of which you are one,
Yes.
And the Scottish Government. Did you have direct access to the Scottish Government in the pandemic?
Yes, I mean, direct access in ways of obviously corresponding with them directly, and there was also the groups started to get set up, so we did have direct access to ministers, and I think it would be fair to say that correspondence was regular and done in quite a timeous way. So yes, I would probably say there was direct access. Yeah.
And I think one of the examples you give in paragraph 25 of your statement is about an issue that was raised with the Scottish Government and resulted in a letter of apology, which was sent, the Health Minister, Jean Freeman,
Yes.
sent to the Scottish Ambulance Service. Can you tell us a little background to that, please?
I couldn't be specific about it. It wouldn't be the area that I was directly involved in, but I do remember the letter coming in, and I think it just highlighted again that the pressure that we had, or the issues that we were raising, whether that be pressure being put on ministers as well, when that came in relation to the Scottish Ambulance Service. I can't remember directly the issue that was raised, but I do remember the letter that Ms Freeman returned to us was very gratefully received by our trade union. Yes.
Okay, thank you. Can I ask you a little bit about PPE? I think this is one of the main subjects within your statement. And you deal with this at paragraphs 26 through to 38. You mention various issues around the availability and also the appropriateness of the type of PPE in the private healthcare sector. And I think within the private healthcare sector, we're talking about both care homes and care at home. We can obviously read what you say about this, but there's just a couple of what may seem small points, but they're perhaps important that we get this evidence out that I'd like to take up with you. One is about out-of-date PPE, and that's something you do refer to. Can you give us a little more detail about complaints or representations that you are receiving from your members about the use or availability of PPE that had passed its sell-by date?
Yeah, we are concerns about the access initially to PPE and what type of PPE was going to be appropriate in care home settings and care at home settings as well. Some of our, I recall some of our members being advised possibly not to wear the PPE as it was, causing heightened tensions with the people that they were looking after, and certain PPE, if we were challenging organisations about what levels of PPE they had in their establishments, they were saying that they had the certain amount, but it was in some cases our members couldn't get access to that, and I think that was all building up. And then I do recall certain instances where some of our colleagues had come back to us saying it wasn't maybe the most appropriate PPE that they were being issued with. I can't recall the actual issue with the particular in the care about being out of date. I think the Scottish Ambulance Service provided evidence, our members in the Scottish Ambulance Service had provided evidence about the PPE being out of date there. But certainly our members in the care sector had made concerns about the poor quality of it, ill-fitting masks, and some of that being the dates on the masks being out of date. And I think it compounded with the lack of engagement that we were having with some of the care companies, where we didn't have recognition agreements with, where we couldn't actually bring this up in a more structured way, and we were having to go in directly with the employers to try and get these matters resolved.
Okay. Another point you make reference to is the absence of risk assessments in the event that there were outbreaks of COVID within homes, obviously. You refer to this at paragraph 35. Again, can you give us a little indication of what sort of issues were being raised by your members in that context? Yeah,
where we have agreements in place, very important matters of that are, risk assessments, particularly around, obviously health and safety, and that would be where a local representative, if there was an issue, could be accompanied by a senior official from their employer to inspect the matter, to deal with it, and hopefully get things resolved. The issue that we were talking about previously, possibly the poor quality of the PPE, some of it being out of date, some of it being difficult to access for our members. These are the sort of things that could have been dealt with through proper risk assessments taking place with the trade union and the employer working together in the place of work where something was of concern to them, and if that wasn't in place, then the reality was that we had no reassurance or little confidence that it would actually get resolved.
One of the other points you make, it's at paragraph 32 of your statement, is the quality of PPE, but you go on at towards the end of that paragraph to say that some care workers were also advised to reuse PPE. Yes,
yeah. There was a concern that the PPE, in certainly care sectors, there wasn't enough of it. availability wise for it to be changed regularly. And I do recall, certainly speaking to some of our members who were taking their own gel in, their cleaning gel, etc., and being advised to sometimes use their aprons and masks again. And I think, if I recall, around that time there was a shortage of PPE, and I think possibly that would be why that was happening at that particular time.
Final point in relation to PPE I'd like to ask you about is perhaps something that we haven't heard a great deal about, and that is the provision for safe disposal of PPE. Maybe fairly obvious, but can you explain to us why it's necessary for there to be safe disposal?
Obviously, if that had been being used on shift, there needed to be arrangements put in place for it disposed of. All it goes back we touched on earlier, where if there would have been a proper facilities in place to raise these through possibly risk assessments in the workplace, that these sort of things could have been avoided. But at that particular, I remember at that particular time, concerned that they didn't know where to put the PPE that they had just used when they were on shift and where to leave it. And these reports were coming back in that PPE from previous shifts were visible in the places that they were working. Obviously there's a lot of concern.
Okay. Paragraph 37, I think you bring a lot of these points excuse me, and again we can do that. You do say there is a lot of people who are really frightened that the care homes are breeding ground for COVID-19. Again, is that something coming from, or was that just a understanding from in the news media?
I think possibly both, but the anecdote we were getting from our members, that they believed that they were going into it. COVID-19 was being spread around, and the issues, people leaving their after and going home, and the spreading that way. So I think those fears were indeed and completely understandable, given the some of our members were working in.
Right. You mentioned to a letter that was sent by or on behalf of 1,500 members, dated the 4th of April 2020. Again, a few weeks into lockdown and the pandemic in the UK, and it was sent to the First Minister, alerting her to the difficulties and pleading for assistance. Now, probably realise that unions, for some politicians, can be a bit of a nuisance. I'm not suggesting you are, but I'm sure that that's probably... Were you just being a nuisance, or were your members just being a nuisance at this stage, or was this something that was genuinely an issue for you?
I think it was genuinely an issue, and I think the First Minister at the time was always very courteous with her responses. I think you make reference to it being early on in the pandemic. I think what I touched on earlier, I think our experience was that even prior to the pandemic, we were aware of issues in this sector, and with what the coming storm was going to bring, we thought this was only going to make things worse. So it was the evidence that we'd built up over a long period of time that we wanted to alert, First Minister and government officials to as early as possible.
Could you just read out the quote that you've given from that letter?
Yes.
In paragraph 37?
Yes, the letter stated, "We do not feel safe at work. You have lost our confidence by publishing guidance without consultation with frontline workers and by forcing us to work with insufficient PPE."
That, obviously, we know the date of that. Subsequently, did matters improve?
I don't recall matters improving. My recollection of issues at that time was a constant campaigning on behalf of our members to get the correct PP out there. At the time, I appreciate it was a really, really difficult time, but with the shortage, the kind of general shortage of PPE at that time, my recollection of that time was very, very difficult.
Yes. In paragraph 38, you tell us about a survey of private care members on the matter of pay, of both PPE and pay. This is dated the 30th of March 2020, and you summarize what that survey disclosed. So could you just tell us about the results of that survey, please?
Yeah, so my recollection again would be that we would be getting an overall picture of our members in this particular sector, and a decision would have been made to ask the questions to as many of our members as possible, to get a snapshot or a real-time information about what it was like for people working in the care sector, and the results seem reasonably profound, and I think it only goes to show about the high levels of our members' views that, masks, soaps, hand sanitisers, etc. But those would have been stimulated by inquiries from our members coming into GMB, sort of central office.
Yeah, I think we can see that those who responded to your survey, 76% said that they had not been provided with appropriate PPE, and you give the examples. 85% had not been provided with masks. 99% would support additional payments for private care workers, perhaps not surprising, but and then many stated that they were scared, anxious, stressed, overworked, undervalued, and angry about being let down by the government.
Yes.
And so their anger on the basis of that response was directed towards the government.
I think at the time, guidance and legislation was being updated and changing, and it was a confusing picture. So, and I think some of the regulations that were coming down from government sometimes took some time to filter down into the workplaces, and we had been challenging the government on a couple of things around the sick pay fund, etc. But the first 3 points are certainly are more work related than anything, I would say.
Thank you. I'll ask you a little bit about testing, which you go on to deal with. You make the point that the delay in testing care home staff was a matter of considerable concern.
Yes.
And at paragraph 40, you raise the issue, which is, of course, one of the issues that the inquiry is specifically directed to consider, and that's the transfer of patients from hospitals to care homes.
Yeah.
And you talk about, with that background, a letter that the GMB Scotland sent to the then Health Secretary, Jean Freeman, on the 22nd of April 2020. And again, can you explain what the background to that was?
My recollection would be that there was a view that the hospitals were going to be inundated with people who were suffering from COVID, and that as much space had to be made available to people who would be sadly suffering from that. And it was our view, or my recollection certainly, that then the consequence of that would be that people who would be in beds in the hospitals would have to have their care taken elsewhere, and the option would be care homes, which did happen. And I think there would be a concern that either people were leaving hospital untested for COVID going into a care home, but also as well that people would be leaving hospital possibly going into a care home where COVID had been spreading. So there was multiple concerns about the process.
Now, you indicate that this correspondence from GMB Scotland to the then Health Secretary did not engender a response.
Yeah.
Is that a surprise to you?
I think overall the correspondence that we had with the government, most of it was responded to. I think, if my memory serves me correct, is that possibly Ms Freeman would have, I think, picked up on this in a later correspondence with our trade union. But overall, I would say our correspondence was met with a response.
Yeah. Moment. Fortunately, I can't find the particular reference. My apologies for that. Just, I think you were concerned that there was no consultation, as far as you were aware, with the GMB in relation to the transfer of, I found it, the transfer of patients from hospitals into care homes. Would you have expected that?
It's probably one of the, on a personal basis, one of the defining moments I recall. It was very hard to comprehend. I can understand the reasons, because at that particular time we were all concerned about people, contracting COVID and how they were going to be treated. But as I said, I think the concern was that if my recollection is correct, it seemed to happen quite speedily, and I think if we had been consulted about it, we certainly would have had a lot of information from our members about certainly what was going on in the care homes, and the concerns that we had would be, obviously, patients from hospitals going in there either untested or otherwise going into a care home that did have COVID spreading in it.
Yes, it's paragraph 46. My apologies for losing the reference. And you conclude that paragraph by saying, "I was dumbfounded to find out that untested people were being discharged into care homes."
I think, yeah, because of the level of work that we were involved in with the care homes, we certainly knew, my colleagues and myself knew how bad it was in there, and it was difficult to, if as again my recollection, but it was difficult to actually recall a care home that wasn't affected by COVID.
And I think the concern also extended not merely to those who are working in care homes, but obviously also for other residents within the care homes.
Yes, exactly.
But also those who are transporting people
Yes.
from hospital into care homes, ambulance drivers.
Yeah, exactly, and you know, I'm sure my colleague, when she gives evidence about that, but certainly, you know, the emergency service members that we have in patient transport, etc. Yeah, there was a whole sort of consequential risks that would have been happening.
You also tell us, we go back to paragraph 45, that there was another concern, which was that symptomatic workers were being instructed by some employers to attend work, and you indicate what was symptomatic in that context.
Yeah.
Again, was that something that your members were informing you about?
Yes, and I think that I think a lot of employers were looking for exact, you know, proof that they had. A member of ours would have had COVID, but if they had the symptoms, there was a real risk, and essentially, you know, I think, you know, people who had symptoms were reasonably confident they certainly had something and didn't want to go to work, but essentially, you know, as it says there, essentially due to staff shortages, pressure was being put on our members to go in, and we were having to, you know, give, you know, one-to-one advice about, you know, to support them.
And you indicated that in certain instances they were given the instruction to attend work, and the possibility that if they didn't do that, then they wouldn't get paid. Yeah,
yeah. Even prior to COVID, you know, there's very little provision for people in the private care sector for proper sick pay. But yes, I think it would be safe to say that if you don't show up for work at the private care sector, then you're going to be facing considerable financial hardship. Yeah.
I'll ask you a little bit about staffing levels and agency staff, which is something you talk about at paragraphs 50 and following. And I think, just looking at the various points you make, you begin with the point that there was a pre-existing problem, the level of staffing in care homes, in your view.
Yes.
You also refer to the difficulty in recruiting new staff, and also the impact of illness, isolation, shielding during the pandemic. And you talk about the strain that placed on staff, both physically and emotionally. In paragraph 51, you describe that as enormous. Again, this was something that your members were reporting back to you.
We were trying to provide as much support as possible to our members that were getting in touch with us, but with obviously in the paragraph before, we had done some work, my trade union, you know, about the turnover of staff. We had got information that it was around 30% of staff turnover. Some in the sector consider it to be possibly higher than that at that particular time. But so that was what we were going into the pandemic with. But obviously, with people starting to contract COVID, people being scared to go to work, and the same amount, if not more people, after the hospital discharges are taken into consideration, it was more and more work was being put on people. And yes, I used the word enormous, and I do recall having many conversations with our members that carried out that work, and what they were going through. It was a very difficult time for them.
You've made the point in that section of the both the physical and the emotional impact that this had upon your members working in the care sector. You'd go on to deal with mental health as a separate subject at paragraph 77 and following. We can obviously read what you say there, but at paragraph 80, you say that you remember speaking to members who would be phoning us to say that they were very scared going to work, knowing that they would be returning home and potentially taking the virus back home with them. You say this was a very profound moment for us. That's one of the things that I will always remember. You give us a little context to that, please.
Yes, the reality was, the carers have had their own families and their own issues as well. And I do remember some carers, when they got time off or days off, they actually wouldn't go home. They would actually stay on site to minimise the risks for their family. And I think it just goes to show the dedication that they had for the people that were looking after, but also the real concerns that they had about taking the virus back home to their loved ones.
You also, at paragraph 81, provide us again with another one of your surveys, and this is of private care members of your union and the impact on their mental health. Now again, this is very early in the pandemic. It's the 20th of April 2020, and it's one to which you received over 1,000 responses. In terms of the way in which you do receive responses to surveys you send out, is that a relatively, I don't know whether I describe it as good or forceful response? Yeah,
I think it I think we would at the time we felt that the responses that we were getting, we were confident enough that was gathering information that we could release to wider sources or use it in government correspondence with the government. So I think that the surveys were giving us significant information at that time that we probably, as I said earlier, we would have picked up in workplace visits. And again, we knew that there were issues prior to the lockdown. So I think that's why we acted very quickly at the outset of the pandemic.
Right. Presumably you reacted by taking this survey because you were being told of the emotional toll that the pandemic was having on members.
Yeah.
And I think we can see, I'm not going to go through each aspect of the survey, but I can take two aspects. That at little letter D, 84% of the responders said that they were in fear of taking the virus home, and that was causing them stress at work. And also 74% were fearing for their own safety.
Yes.
Could I go back, your statement as I diverted off to look at that section on mental health. Could I go back to look at paragraph 56, please? And this is in relation to the concern about the use of agency workers in care homes. Now, I think obviously we all understand what agency workers are and that they form a necessary part of the workforce in care homes. What was the particular concern about agency staff?
Well, yes, the agency staff were obviously used even prior to the lockdown to essentially supplement, the staff shortages. There was concern that, even early on in the pandemic, that there was no control over where agency workers would be going. They would be sent to different care homes, different sites, and I think there was, a real and genuine concern that that visiting different sites was an area where they felt that the pandemic could spread more easily, and at least if you're employed in one care home, I think it would be safe to say that it would be easier to monitor staff etc. with what's going on, but with the use of agency and you don't, it's workers coming in, you don't know who they are, where they've been, etc. I think that was the areas that were causing concern to our members.
Right. A couple of points, if I may, on shielding. The paragraph 68, and again we've heard a little about this, but I'd like to ask you your own view on it from what was being relayed to you by your members. There's a lot in the last sentence of paragraph 68. You say there was a lot of concern about members who were pregnant. What was the state of knowledge at that time about the position of those who were expecting?
I think the reality was we were all unsure, but the real concern was there. We were obviously seeing what was happening in other countries, and as COVID started to hit the UK, people who had medical conditions, whether they had medical conditions and were going to work, or they had their loved ones or family had medical conditions at home, there was a real concern that going to work in a care home or going to deliver care in people's homes, you're at real risk of picking up the virus and spreading it. And I think at the time, in relation to our members who were pregnant, I think there was just a real concern that there was no, at that particular time, no protection put in place for our members who were pregnant. And I remember distinctly having a one-to-one conversation with a member about the concerns, and and I'll be upfront and advised her not to go to work, even although I knew the financial hardship that would bring.
The other area in relation to shielding I'd like to ask you about is what you say at paragraph 70, that some employers were persuading members to go to work when they should have been shielding to make up for, I suppose, account for staff shortages. So you were getting that information as well?
Yeah, directly from our members, and it goes back to what I said earlier, that there were staff shortages prior to the lockdown. So if you can recall all the difficulties and the issues that were happening at that particular time, with more people coming into the care homes and more people maybe going off unwell or avoiding going into work, then the pressure was being put on our members who had loved ones at home or themselves may have had medical conditions that would have caused them concern if they had caught COVID.
Sorry. In that sort of situation, what sort of representations could the union make during the pandemic?
Yeah, well, if it was if we were picking it up with a particular organisation, if there was several people coming forward, then certainly we would inquire to the organisation as to what was happening, if there were other ways that this could be resolved, rather than putting pressure on people. But the reality was a lot of it would have been one-to-one support, and at that particular time, it was these cases were very emotional. Because people had real concerns about, essentially, do I go to work with all the risks that will undertake, or am I going to be facing financial hardship by not going to work? So a lot of the work that we did during the lockdown had changed to a lot of it being advising and, as I say, very emotional support at that particular time.
So, paragraph 71 and following, you talk about communication and support. You make the observation in 72, something obviously we've heard a lot about in different contexts, that guidance, government guidelines changed at very short notice. Now, what you say in relation to this was that this caused confusion. But you go on from that to say a mistrust of Scottish Government ministers, and you say that you still think that lingers on today. Now, taking that in various parts. Can you explain and understand the confusion? Can you explain why in your members this was causing mistrust of Scottish Government ministers?
I think that a lot of the guidance that was coming out from the government at that particular time, I would say it was being said in good faith, with the hope and expectation it would help workers in their own specific workplaces. I think by the time it had filtered down to that level, the reality of what our members and workers were facing was very different. You know, there was issues around we're talking about earlier on about the agency workers not supposed to be going into a variety of workplaces. That took a while to come down. The social distancing. How can you actually operate in a care home while still having to acknowledge the social distancing and the 2-metre rule? So there was issues like that, and as I said, I accept that these announcements, a lot of them were made in good faith, but the reality was it was a different picture on the work floor.
And what you're portraying is that your members had a mistrust rather than perhaps a misunderstanding, that they had a mistrust of what the government was doing at the time.
Yeah, I think it would be that element that there would what they were actually facing in the workplace at that time didn't correlate with the announcements that were being made by government ministers. And I think as well with the probably, in my own view, there was just this lack of engagement with a lot of private care employers to engage with us direct. So a lot of it we were taking up with the government, where maybe in a better world where we could have been dealing with employers direct, we could have got these matters resolved. But I still think that when announcements were being made, as I say, in good faith, by the time they had filtered down to our members, it just wasn't the reality that they were facing.
Paragraph 74, you tell us about the Care Home Rapid Action Group set up by the Scottish Government in May 2020. But this was after considerable pressure from the unions, and it came too late. Can you tell us a little bit about that group, please?
Yeah, I wasn't part, I didn't sit on it myself, but I do remember that there was a variety of groups set up, and even with the title of that group, it was a forum that information could be fed in very, very quickly. It was reasonably early on in the pandemic, but as I said, we had real concerns about the sector prior to it. So it was an avenue for us to raise issues at a reasonably speedy sort of when things became relevant to us, certainly from the information we were getting from our members. But there was that many groups. I think sometimes a lot of information was getting lost in there, and it was very difficult for us to relate that back to our members who were coming to us with very serious issues.
I think that's what you say in the last sentence.
Yes, that's
74.
right,
Yes.
Mm-hmm.
Right. Going back right to the beginning of your evidence, you mentioned that you perhaps wished that at the outset of the pandemic there had been a national strategy, which I think was what you were calling for in your union's letter to the First Minister in March, on the 19th of March. If there had been a national strategy, what would the GMB have regarded as being the essential elements of that strategy?
Yeah, I think for us, looking back at that, I think personally, I would like to have seen that we would have more positive dialogue with private care employers, rather than us having to be, take up concerns with our members in the first instance, very top level of organisations. I think the national strategy kind of sets a scene whereby that, irrespective of where the care home was situated, what type of care that was being provided, everyone was going to be affected by this. So let's try and all work together. And what was, I think, the General Secretary, the Scottish Secretary at the time, the General Secretary now, he said, was going to be a national emergency, and I think we would have been looking for the general day-to-day issues between employer and trade union. Well, they wouldn't have went away, but I think we could have all realised that if we were going to work through this together, it could have been a more cooperative and collaborative approach, and unfortunately that failed to happen.
Okay. There's one other point you make, Mr. Arkison. Paragraphs 86 to 88, you deal with the impact of the pandemic on people receiving care. And obviously, this is something we have heard a lot of evidence about. One thing, again, it's just interesting to get it from your perspective as representing a large cohort of people who work within the care sector, is that, as you say in paragraph 87, there's no substitute for physical touch from family members, and also presumably where there are no family members, from carers. That's presumably something that your own members were telling you.
Yeah, in fact, in many occasions our members will actually comment that the people that they look after as their extended family, and they would obviously be coming back to us with the importance of that, and obviously having to try and substitute that because people, at the time were locked out of care homes, and our members in the care homes were trying to replicate that or trying to substitute that, which is very, very difficult for them. As I say, even today and prior to the COVID, they will comment on the people they look after as their extended family.
Thank you. Now we have your lessons to be learned and the hopes for the inquiry, and we can read those, and we're grateful to you for you and your union giving your thoughts to those matters. In conclusion, Mr. Arkison, can I just ask you, is there anything that you would like to further say that we haven't perhaps dealt with in the course of the discussion this afternoon?
I just would like to conclude with a couple of sentences, if I could say
yes,
that.
Please.
Just overall, employers in the private care sector have failed to improve the working lives of our members since COVID. Still today we're seeing care homes shutting with a few weeks' notice, and care companies ignoring workers' statutory rights and only paying the legal minimum of pay. Prior to COVID, this sector was in crisis, and post-COVID it's difficult to see if any positive change has come from the employers. And that's all I'd like to say, and I'd like to thank you for listening to what I've had to say today.
Right. Well, thank you very much, Mr. Arkison. Those are all the questions I have for you. Thank you, my lord.
Yes. Yes, thank you, Mr. Gill. Thank you, Mr. Arkison. That's conclusion today. Is it 9:30 tomorrow morning, Mr. Gill?
Yep. Mr. Neil tells me yes.
Yes. 9:30 tomorrow morning, then. Thank you.
Thank you, my lord.